RSE and Health Education, links to food and nutrition, and your role. So we're going to be looking at the RSE and Health Education overview. When's it going to become into place? When's it going to become compulsory? Aspects of the curriculum relevant to food and nutrition, your role in planning and delivery, support from Food Facts of Life and the Food Teacher Centre, and other sources of information and support. So first of all, I'm just going to cover sort of the overview, the introductory bit. So it's important to remember that the new relationships education and sex education and health education curriculum is only relevant for England. And relationships education is compulsory for all pupils receiving primary education, and relationships and sex education is compulsory for all pupils receiving secondary education in England. Now, health education is compulsory in all schools in England except independent schools. So the relationships and the sex education is compulsory in all maintained, non-maintained or independent schools with sixth forms, including academies and free schools, non-maintained special schools, maintained special schools and alternative provision, including pupil referral units. Saying that about independent schools, it's important that independent schools still commit to their PSHE with their pupils, and they must meet the independent school standards. However, DfE have said that schools may find the health education element of the curriculum helpful. That's independent schools. Now, DfE have also said that parents and carers are the prime educators for children on many of the matters covered in the curriculum, and that schools complement this. So it isn't schools' only responsibility to do this, it is the parents and carers as well. So the aim of the curriculum is to put in place the key building blocks to healthy relationships, good mental health, and healthy and active lives. So for primary, it's thinking about healthy, respectful relationships, focusing on family and friendships in all contexts, including online. This sits alongside the essential understanding of how to be healthy. For secondary, what's really important is that the teaching at secondary builds on the knowledge acquired at primary. So it isn't separate. You have to make sure that you're continuing with what you were teaching at primary and then continue that with additional aspects at secondary. Particularly at the moment, and also going forward with this, teaching about mental well-being is central, especially as consultation found that their children's happiness is a priority for parents. So the compulsory subject content must be age appropriate and developmentally appropriate. It must be taught sensitively and inclusively with respect to the backgrounds and beliefs of pupils and parents, whilst always the aim of providing pupils with the knowledge they need of the law. The curriculum complements many national curriculum subjects, and schools should look for opportunities to find links between subjects and integrate teaching where appropriate. And a whole school approach, which Louise will talk about in a bit, to wellbeing and health should be also taken into account. So when, this is the important thing really as well to think about. So it will actually become compulsory in England from the 1st of September 2020. And schools should, where possible, continue to prepare for this date. However, the DfE have said that due to COVID-19 and school closures and the impact that that's had, some schools may not be in a position to implement this fully from September. So there has been some flexibility granted in delivery until summer 2021. But DfE said that schools should try and implement it as soon as possible, but that a phased approach should be implemented where needed. So the link on the screen will actually take you to the DfE information about that. And then also the DfE have said that schools should consider prioritising curriculum content on mental health and wellbeing, as knowledge on supporting your own and others' wellbeing will be important as pupils return to schools. So as far as the areas that are relevant to food and nutrition, it's obviously not all of it, but it is physical health and mental well-being, but particularly healthy eating. And again, it's important to remember that within physical health and mental well-being, there are other aspects that will need to be covered. So it's not just healthy eating. There's physical health and fitness, and then also health and prevention. And as I said earlier, the guidance states that secondary schools should continue to develop knowledge on topics specified for primary as required, and in addition, cover the specified secondary content. Okay, Louise, so it's you now. If you'd like to go through your role in planning and delivery, and if need be, I'll go through the slides for you.
Thanks, Frances. So yeah, just a few slides on the role in delivering this. And as Frances has mentioned, this is much wider than just about healthy eating and food, but there's a particular role that those that are specialists at both primary and secondary in food and nutrition education can play in this very important new set of statutory requirements in schools. So I'm just going to talk about your role in terms of, as it relates to food, of what you might be able to offer. And as Frances said, there needs to be a school policy in place, and there's flexibility for schools to create an age-appropriate developmental curriculum to specifically meet the needs of the school. So there isn't a set curriculum to this. So schools have been left at this time, and they've been given a bit of extra time to plan how they're going to implement this right across the school. Some of our food and nutrition specialists also coordinate PSHE in their school, but others don't. So this is an important time to be able to work with the person who is going to be coordinating this in your school. So we're going to suggest some documents, which I'll come on to shortly, that we've provided to help make this process as easy as we possibly can for you, and to really focus it for you. Everyone's so busy, and there's probably at the moment other priorities. So this might not be something that you do now, but it might be something you alert the person who's leading in your school and the senior leadership team to the contribution that you can make, and maybe come back to it as your school starts to develop their curriculum and their school policy around this. And the particular aspects that are related to food are the ones that we should start by examining and reviewing what you already teach at key stages 1 and 2, 3 and 4, and how this overlaps and already meets the requirements probably going forward for 2020, or if there's some new things that you ought to build into your teaching. And as Frances mentioned, the strands here talk about health and fitness, so what constitutes a healthy diet, and the principles of planning and preparing healthy meals, characteristics of a poor diet and risks associated with unhealthy eating. All of these things are included within the primary and secondary requirements. And so for many people, this means looking through what you're currently teaching, where that's currently taught, so that you can begin to map how you can contribute to those strands that are within the regulations. Once you've done that bit of mapping, I think the next best thing to do in terms of your role in delivering this is to talk to those people that are coordinating your school, the PSHE coordinator, the SLT, about how what you're doing and what you can do meets these requirements, and explain when you teach it, so which year groups this is, which term you're teaching in, and how you're actually teaching in your lesson, and how you're able also to assess the students' achievements and attainment within these objectives as well. So the review is first, then sharing that with the people who are doing the planning within your school and being part of that planning process. Then providing some planning and communication. So you're probably going to have to provide your mapping so that that's part of the school overall plan, because as expected, this is going to be delivered across multiple subjects and areas, and in the school they're going to provide a coherent plan for this. So you'll contribute your mapping and your planning to show where you are delivering these aspects. And then of course the final part would be about reporting, because as well as building it, and it's maybe already built into your teaching, and providing particular content in your mapping that meets these requirements, it's also important that we formally report on what the students are able to do, your achievement of those students. So again, it might be that you need to have a look at some of the assessment that you're using. And then just to, as we said, to make this as easy as possible, Perhaps Frances can just take us on to the next slide, where I talk about the key documents that you can use to access this, to make the process as quick as we possibly can for you. So we've done a one-page summary on these requirements, so you don't have to read, you know, all of the pages, because as Frances said, it covers many aspects of health education. So we've done a one-page summary of the bits that are, you know, of interest to food and nutrition specialists. So that's the first thing to look at, because that will help you then to do that review. The second thing is that BNF have done a brilliant set of mapping against these requirements and supported you by tagging all of the relevant resources that you can use to teach the elements that are required. That will be really helpful for your subject teaching, but it might also be helpful to be able to direct other teachers to this mapping, so that they're using the most up-to-date teaching resources and information possible across the school. So that mapping is really helpful and will save you a lot of time in trying to locate key resources, for example, to teach about some of those things that we're talking about healthy meals, about you know, what happens when, you know, health-related diet issues and things like that. We've also provided for you care of Joe Mann down at Torquay Girls' School in the Southwest, an example of school mapping that he has done, and just a very, although you wouldn't be able to necessarily look at this in great detail, you probably have your own school mapping, your own scheme of work, but how he's been able to create a column to show, well, what he is teaching at years 7, 8 and 9 and beyond that to match against these curriculum requirements. And the last bit, just to make it easy to access, because again, sometimes the government websites are not easy to find your way around, just a link to the government requirements. So what are they expecting you to do? We certainly suggest that this one-page summary, the BNF mapping of all the key teaching resources to teach these requirements, your school mapping that you finally end up with, and the government requirements are something that you probably want to download and have in your departmental handbook. Certainly, if that's a physical handbook or electronic one, these would be key documents to talk about with Ofsted with regards to your subject planning. I'm just going to ask Frances to move on to the next slide and just show you, although you won't be able, obviously at this distance, read this, especially if you're on your mobile phone listening in, read this in some detail. But this is the example mapping that Joe Mann has provided. This is his Year 7 scheme of work, where he introduces healthy eating and the Eat Well guide. So he indicates that with a highlighter pen under the topic. He then has some department intent. So this is, what do the students learn? You know, the definition of a healthy diet and the reasons we need to eat food, and how the Eat Well guide can help you towards a healthy diet. And in the column there called cross-curricular links there, it maps it against those health education requirements and the strands we talked about, healthy lifestyle, healthy eating, and picks up that it has teaching about the Eat Well guide, personal hygiene and dental health, things that are requirements within those regulations. And so it might be, this is the sort of way that you could do your mapping, you know, so that it doesn't take a lot of time. You can review your scheme of work as Joe has done, use a highlighter pen to highlight to senior leaders and your PSHE coordinator which year groups you're teaching, what topics you're covering, and what that looks like in your lessons. So you know, this is the kind of level that we're looking at. So nothing too onerous, but something you could pass on that's concrete to your senior leadership team. And then to move on a little bit more for tips for delivery. For most of us, our schemes of work, if you've kept your curriculum up to date and it follows the national curriculum, the demands of this new content will probably already be met largely within your scheme of work and your lessons. But you might need to do some tweaks, and it's always a great opportunity to review what you're doing. But largely not things that are extra, but really strengthening what exists already there. But I think the one thing that makes this really very interesting as a set of regulations is this idea that it has a very practical application. You know, there's always been this concern that some of the work on healthy eating is done in a theoretical sense, but the students and the pupils and the children don't often have a chance to put that all into practice. And I guess this is where we have a unique opportunity for actually doing these things for real. The planning and preparing a range of healthy meals is something it's not done as a theory, it's done as a practice within our lessons. Being able to understand personal hygiene, it's not just about the science of that, but yes, of course, understanding about bacteria, but putting that into practice with hand washing routines, knowing how to handle and store food, all of those things that we get an opportunity to practice and embed that learning for real, so it becomes a habit and a behaviour, not just some facts that are learned in the class. So this is kind of the uniqueness, because there could be other subjects that say that they're teaching these things. Science could be talking about bacteria for sure, and other lessons might contribute. But I think what we need to emphasise within our delivery is that the fact that we give students a chance to do these things and create real dishes and recipes to take home, that it might influence what happens at home as well, and an opportunity for them to understand and adjust their own diet. You know, if we're talking about health risks of a poor diet, giving the students that empowerment to make a change in their diet. So in terms of delivery then, this opportunity to review gives you some clear focus to review against, as well as the national curriculum, which many of us are already teaching. And that clear view might also help us to sharpen what we include in assessment, but also to be much more explicit in how we word the outcomes and objectives for our lesson, so that they align with these regulations, so that maybe it brings that healthy eating and this practical application to the fore. So it's very evident for people who are reading our schemes and our planning what the focus of the learning is and how it's related to these new requirements. So hopefully that sounds quite manageable for most of you. And there's plenty of help there with the mapping and the documentation to make this straightforward and effective to deliver. Just going to move on to maybe the next step that you might take. If you're an experienced teacher or somebody who would like to have more responsibility across the school, many teachers do ask us about this. Because this is being taught in a number of areas in the school, you might offer to be that coordinating force across the school. So where you've got a number of teachers contributing to the teaching of healthy eating in PE and science and perhaps tutor groups, could you be that person to offer to lead, to make sure that this learning is consistent across the school? And be that person who is able to direct staff to the recommended teaching resources, because this is often where we see things do maybe fall apart a little bit, where, I don't know, popular magazines with misinformation or the pyramid style of teaching about healthy eating, where teachers who are less experienced than us and do not have a experience in food and nutrition might simply Google around for some resources, whereas you could guide them towards those resources that are nationally used and help us develop this consistent approach and consistent messaging around healthy eating, so that young people don't get confused. So obviously Ofsted will be looking for a coordinated approach. It might be something that you can help with. And they're looking for this because when it's coordinated, learning is much more effective. And the learning is built on each subject. There's progression there and there's consistent messaging. And students don't get confused when they're told one thing in one subject and another thing somewhere else, or read different things. So it's worth thinking about whether that is something that you might want to offer to do when you hand over your mapping and talk with your people back in school when this is being worked on as well. It might be something that you're able to do. And then I'd just like to move on to talking about what we might do in terms of reporting and communications, because I think there's kind of two things that will be key here as well. We've talked about helping your school build the policy, mapping where this happens in your lessons, and the third part of that would always be about formal assessment and reporting. So this is a good opportunity for you to reflect on what things you're assessing: end of year tests, end of key stage assessments, the school reports that you're writing, those formal reporting procedures that you have, and how far are you along the line of making sure that these are important outcomes that are assessed, and just to make sure we build this into our assessment processes. so that you can report on these specific achievements. So in some ways, you probably already have your assessment built around assessing the national curriculum. So again, having a chance to look through the key statements that are in these requirements and making sure that these are not only taught, but also assessed and reported on as part of your formal reporting process. So that's key as well. And finally, because we're doing so much good work around healthy eating and nutrition, one of the things is to make sure we communicate that that's what our lessons are about. And it will be interesting when you first talk with the PSHE coordinator and your SLT about this, about whether, whether they're familiar with the extent to which you're already teaching these aspects as part of the national curriculum that you already teach. It might be news to them to see that highlighted scheme of work that you might send over and just how much you're already doing, or they might be very familiar with the level of work that you do. But it is important that we have that communication both within the school, that internal communication, PSHE coordinator, SLT, governors, but also to the pupils, that they're familiar with this. You might do that through a display to show how what they're learning in their food and nutrition lessons contributes to a whole range of curriculum and assessment things that are very important. And the final bit is about communicating outside. Is this something you ought to have when you get a little bit more time than you've probably got now? But is this something that you could review your subject website section? Nearly every school's got their curriculum on the website, so that parents can read what it is that this, what your subject contributes. And just to check whether this is given a mention to show the contribution that you make to those wider aspects of the curriculum. Again, sometimes parents think we're just about cooking, don't they? So to better communicate the health understanding and the contribution to pupils' well-being and future health will be really key to include there too. And why is that communicating and reporting important? So move on to that slide. So why is this important? It's really about strengthening our subject, strengthening the importance of food and nutrition being taught. We already have a compulsory national curriculum, key stages 1 to 3. And with this PSHE becoming compulsory as well, even in academies, so all schools, all state funded schools are going to be required to plan a curriculum for this delivery. This means that we have a stronger position within the school. And if there's ever discussion in your school about reducing the time that you've got for your lessons and how many hours you have, or the resources for the subject, it could be one of those things that maybe prevents the subject from being under quite so much threat because of the importance that it's held in, not just because of the national curriculum, but also these guidelines as well. So hopefully that's given you a few thoughts on delivery, and your role, what your role might be. And as I say, this might not be something that you're able to take on board just at this time, but Frances and I felt this webinar was still important to do at this point because this is still being talked about and schools are being given a bit longer to do it, but it might be something you can return to. And if you've got all the information there ready, you can be, if you have some chance this summer to think about your planning, you can be ready with your replanning and supporting your school in this wider sense. So I'm just going to hand back to Frances now.
Great, thank you very much, Louise. That was a really good overview of the roles and responsibilities that that food and nutrition and other teachers can have in school. And I think it's an important point to make that there is a little bit more time, as Louise said, so there's been lots of pressures over the last few months that we can all understand. But just as a quick overview, so in theory, the new curriculum will come into place from September 2020, but there is some flexibility until summer 2021. And the DFE is suggesting a phased approach with a focus on mental health and well-being. And the aspects that we've been looking at today, so physical health and mental well-being, so thinking about healthy eating, physical health and fitness, and also health and prevention. So just a little bit about support from Food Effective Life. So as Louise has mentioned, we've actually mapped the RSE and Health Education curriculum against the D&T, cooking and nutrition, and science national curricula, as well as the core competencies. So we've got 3 documents, and we've got one which is Key Stage 1 to 4, so that's a sort of combined document. We've got another one which is primary and another which is secondary. And then we've also been talking about whole school approach. So on the Food Effective Life website, you'll find quite a few resources which will help with that. So we've got an area which is around whole school food policy. We've got one for food provision, breakfast clubs, healthy lunch boxes, curriculum qualifications and frameworks, and then also a new resource we put together last year, which is the guidelines for school education resources around food. So if you're writing new resources or you're using new resources, it would be a really good idea to have a look at those guidelines just to see what you're putting together and whether that meets the requirements. And then Louise, if you wanted to mention about the support from the Food Teachers Centre.
Thank you, Frances. Yeah, during this time where we've seen this, the new developments emerging, we've tried to keep everyone up to date through our newsletters, and with the help of BNF as well, being able to put out in our newsletters these kind of mapping documents and things that people and direct people to those so they're able to use them. You know, some teachers have been able to do this because during lockdown time, some teachers did spend some time reviewing their schemes of work and have referred back to these. So if you want to go to any of our newsletters, they are on our website, so you can go and look there, but also there's a link there to access the April newsletter. And within the Food Teachers Centre itself, of course, that's a great resource for keeping up to date with all sorts of things that are going on. We've created a resource bank folder, and it's got those example mapping and planning and advice that we've talked about. The other part of the closed group, which so many people use, is our mentorship programme. And we do have many teachers who are PSHE coordinators as well as being food teachers, and you'll find some of those who've signed up to mentor others. So if you want to gain some information from somebody who has a bit of a wider insight, if this is something you're interested in, do go and have a look and press on the mentorship program tab within the group, and it will bring up all those different people, and you can go through a structured 6-week mentoring program where you can plan together what you'd like to do and gain that level of support. It's really good for those people that might be quite new to food teaching, as well as those experienced teachers who may be just taking on some newer aspects that they'd like a colleague to be a sounding board with and to help them and to gain advice and expertise. We also regularly use our sort of topic tags, and the search facility is really good for highlighting that shared work. So if you're particularly looking for this topic, if you put PSHE in, it will come up with all the discussion that's happened around this. And finally, one of the other things is, we also offer a lot of training events, usually face-to-face, but obviously at the moment, mostly as this is online. And so again, you can always go and look at the website and see what other online training and events are running across the different programs and projects that we have. Thank you, Frances.
Okay. So, so also we thought that'd be a good idea just to highlight some of the other sources of information and support that might be helpful with this. So we've got nutrition.org.uk, so that's the main BNF website. The PSHE Association, Healthy Schools. Now, this is the advisory and support service, which is based in Leeds, but this actually works with local schools and also others beyond. There's Healthy Schools London, and there's also the Healthy Schools rating scheme, if anybody's come across that yet. So that's a voluntary rating scheme, which is a self-assessment tool, which you might find helpful when putting together your curriculum plan. And then, as Louise was saying, training is always a really good thing, and particularly at the moment, if there's a bit more opportunity, perhaps to do a bit of CPD. So we've got a couple of webinars coming up later on in the year, in September and October, and we've also got quite a comprehensive range of online training, so that's available on the website. And we have a monthly newsletter which goes out to people, our education news, but we also have an additional newsletter which is all about our training, our PPD. So if anybody would like some information about that in particular, please do sign up for that newsletter. So we're actually coming to the end of the webinar now, but I'm sure there have been lots of questions in the chat box. Now, it's been a bit difficult to keep an eye on these as we've been going along. So I'll just have a look to see if there's anything that we can think about now. Alternatively, it might be that what we do is we have a look at the questions and then we come back, we put together a document and come back with the answers to those. But I will just have a quick look at those. Okay, I think probably that's probably the best thing to do, if that's all right with you. We'll have a look at the questions and see if there's any that need to be answered, and then we can do that together and put that on your Food Teacher Centre Facebook group.
Yeah, certainly happy to look at those questions. I mean, I provide some considered answers is often the best way to do it. So if you've got any more questions, add them in now quickly before we'll factor those in.
Absolutely, absolutely. So just before we go, I mentioned at the beginning that we've got a SurveyMonkey webinar evaluation. We'd be really grateful if you could complete that for us, because it's always good to know what went well, what we could improve for next time. And once you've completed that evaluation, you'll be redirected to an attendance certificate, which you then need to download, add your name to, and then print it out for your records or keep it on your own PPD file. So thank you very much. Thank you very much, Louise. I'm sorry we had a few technical issues at the beginning, but hopefully we've been able to get some of the flavour of the new curriculum across to you and the role that you can play in your school. So thank you very much from me. Louise, I don't know if you want to say a quick goodbye.
I will say a quick goodbye, but and good luck to everyone as well, because we know this is a very difficult time. So, I mean, we did, Frances, didn't we? We did discuss whether to do this now or leave it for a bit later, but we thought it was still worth, giving everyone a chance to hear about what's coming up, even though we know that many of you might not be in the position to implement this very fully, very quickly. It's always worth knowing what's happening ahead, isn't it? So at least you can build it into your time then, but not to worry about it too much, because you've been given by government a bit more time to get this happening in your school. But good luck with it all. Best wishes.
Absolutely. So thank you very much, everybody. So I'm going to end the webinar now. Hopefully you'll be redirected to the evaluation. If for some reason that doesn't happen, we will be sending it out via email later on. And as I said before, Louise and I will have a look at the questions and we'll see if we can put together a document that we can circulate to everybody. So thank you very much. Have a good day, and we'll see you again soon. Bye-bye.